COVID-19 changed the way medical facilities, businesses, the local and federal governments, and families perform daily. Hospitals like Rush Memorial in Rush County, Indiana, had to adapt to how they see and treat patients. The hospitals saw an opportunity to expand COVID-19 testing and vaccination by offering their residents a mobile COVID-19 clinic. But from this need came an additional opportunity for the hospital. They now offer mobile clinic services to residents of Rush County, thanks in part to the Emergency Rural Healthcare Grant through the USDA Rural Development.
So during the pandemic, we had a lot of meetings that were all virtual. In several of the meetings, they talked about what our new normal would look like. They spent time talking about we needed to think about how we would be taking care of patients, maybe not in a brick and mortar setting. How would we get care out to folks who maybe couldn't make it or were unable to find a way to the brick and mortar building? So they talked a lot, mostly about vaccines and how we would get shots in arms, as they had said a lot back then. The longer I thought about that and how that would impact Rush Memorial and Rush County and our community, I was really thinking about not just vaccines, but also just care in general. So how could we get the care to the people who, without bringing them into our brick and mortar building? So that's really where this started, because they were talking about mobile units for vaccines. And I thought, why stop with vaccines? Why can't we go right on ahead and provide that total care to patients and bring that doctor's office, that provider's office, right to the folks themselves, and so that they can utilize it a lot easier? The USDA Rural Development gave us the money for this grant, or gave us the grant so that we could purchase this unit. So what we plan to do with the unit, or what we're doing right now with the unit, is we're in a small town called Milroy, Indiana. There had been a physician here, and that physician retired, so that left a big gap in the healthcare for this rural community. So with that, we decided we would go ahead and build a doctor's office here in this small town. However, there was going to be a big gap between getting that building built and with her retirement. So we went on ahead and we're bringing the mobile unit here during the week so that the patients can be seen, and we can help bridge that gap for folks so that they don't go without health care. Because one of the things that we find in rural communities is that folks sometimes have a hard time getting all the way to town or getting all the way to a place where they can get care. So by coming out to their small towns, they have an easier way to get to it. Oftentimes we will have single mothers who have a hard time getting, with childcare and with other things, have a hard time getting maybe rides that they need to all the way into, 20, 30 minutes into town. And so by coming out to the rural communities, they have a much easier time doing that. Also, our senior folks, oftentimes as they get older, they still feel comfortable driving, but they don't necessarily feel comfortable driving in town. They feel comfortable around their own homes or around their own small towns, and they're still safe to drive just in these small neighborhoods or rural neighborhoods. So this is another perfect place for these folks to get care.
So the mobile clinic, it helps out a lot for me. I mean, town's about 15 minutes away for me. So coming here, it just cuts that time out for me. And I work 40 hours a week, full-time job. So having it here and not in town is really convenient because it's like 5 minutes down the road for me. So I don't have to make up that time out of my day to have to leave early or get ready early. I can just go ahead and come here and have the appointment done here, and I don't have to go all the way into town. I think that this mobile clinic is really a good thing for Rush to have. There's a lot of transportation issues that people have that keep them from going into town, keep them from having the medical attention that they need. And this really helps out people that have those transportation issues. And it's not just transportation issues. It could be like my situation where, I'm a mother and I have kids, and it's more convenient for me to come here and for people to get that, medical attention that they need and the visits that they should be, having for their well-being visits and everything like that. So this really works out really well for the community, and it's very important to have.